So I want you all to imagine this. You get a phone call one day that your mom is being taken to the hospital. She hasn't been feeling well for quite some time. Getting to the hospital, you're not sure what's going on. You really just want some answers. They run blood work, they do a bunch of tests, and they finally come in and diagnose your mom with stage 4 cancer. And they give her about 6 months left to live. All these questions come up in your head. What do you do? Is your mom going to be placed in a nursing home? Who's going to take care of your mom at these end stages of her life? The doctor comes in and recommends hospice, but you're not 100% sure what hospice is, what they do. All you really know about hospice at this time is it means that someone's at the end of their life. Hospice care is something that many try to avoid because ultimately means that the end is near, but they don't really understand how hospice works and what you get when you choose a hospice. Knowing hospice is really knowing that there's help out there and you're not alone. There's someone there. Today I will inform you about deciding if hospice is right for you or your loved one, the levels of care provided, and also the hospice team. First, I will discuss deciding whether or not hospice is right for you or your loved one. Making the decision to have hospice provided for you or your loved one can be an easy decision to make if you're knowledgeable of the qualifications. According to the federal laws governing hospice, a physician can only certify a patient eligible for hospice benefits if the patient's life expectancy can be expected to be less than 6 months. Even though a life expectancy is 6 months or less doesn't necessarily mean that the patient can only live up to 6 months. There are many patients now with hospice care who have been with hospice care for years. So I would recommend you living out, spending, the best amount of time with that person, with what time that they have left. Another factor that's involved with choosing a hospice is the financial aspect. The major payment sources for hospice is Medicare, Medicaid, and private insurance. Also, many hospices provide hospice. If you're not insured, they provide hospice on a charitable basis. Next, I'll inform you of the many levels of care available to you when you choose a hospice. When you elect to have hospice care provided, there's many different levels of care that come along with that. One being routine home care. Routine home care is when a nurse comes out from 1 day a week up to 7 days a week, depending on the patient's needs. Another level of care is called continuous care. Continuous care is 24-hour care when it is deemed necessary because the patient is experiencing nausea, diarrhea, a change in level of care, or uncontrolled pain, something that they're going to need somebody there 24 hours for observation. And that continuous care can stay in the home for quite a length of time until, as long as the patient needs someone there 24 hours, then, hospice will stay there. Another level of care is called inpatient care. Inpatient care is when a patient is placed in a facility where they can get the support and needs of the patient. Also, the last level of care that is provided is respite care. Respite care is mainly for the caregivers. Caregivers tend to get overwhelmed, exhausted from taking care of their loved one. So respite care is there. Hospice places the patient in a facility for up to 5 days while the caregiver or family member can have a break from taking care of the patient and take care of personal needs as well. Last, I would like to discuss the different hospice team members that are involved in taking care of you or your loved one. Many people think that it's only a nurse that is providing care, when really it's a whole team of people that are making sure that the end-of-life process is filled with support and care. There is a chaplain that is involved. The chaplain provides bereavement services. A social worker provides the assistance with financial and legal concerns. There's also a home health aide. Home health aides assist with bathing patients and doing light housekeeping. And they can be in the home anywhere between 1 day all the way up to 7 days a week, just depending on the patient's needs. Also, the doctor and the primary nurse, they both coincide with each other and make decisions regarding the patient's care and medications. And volunteers. Volunteers are there to assist with patients, sitting in the home with the family or with the patient. That way the families can go out and do daily activities, go to the bank, grocery store, whatever they need to do to take care of, their home. In conclusion, I've now discussed with you deciding if a hospice is right for you or your loved one, the levels of care provided, and the hospice team members. As previously mentioned, hospice care is something that many try to avoid because it ultimately means that the end is near, but they don't understand how hospice works or what you get when you choose a hospice. So now that you are aware of how hospice works and what is involved, I hope that the decision will be that much easier and you will know that you are not alone when a terminal diagnosis is given. Thank you.